Good morning, everybody. Welcome to this Connect and Learn session organised by Boost, which is the North East and North Cumbria Learning and Improvement Community. My name is Ashley Eaton and I am from Boost, and today we are joined by Andy Crosbie and Fozia Haider, all from the Gateshead Community Bridgebuilders. And they're going to be sharing with us how they've been building community power. So the Bridgebuilders believe that empowered communities are absolutely essential for a healthy society. So in this session, you're going to be able to hear what the team has done to achieve that, the challenges they've encountered, and what it's like to kind of step into this new type of decision-making space and what they've learned through that process. So the Connect and Learn sessions are a series of online learning events planned with the purpose of sharing and spreading improvement work across North East and North Cumbria health and care system. Each has a different focus, so these Connect and Learns are more than just information sharing. They're an opportunity to connect with like-minded colleagues around a specific topic, look to generate some ideas and take forward improvements in your own work, team. Kick off just some very quick protocols. If you could mute yourself when not speaking, that would be much appreciated. Post any questions in the chat, and we'll take time for questions at the end as well. Please listen with respect and be present. Pass on, share the learning, spread the word about these sessions, and please also be aware that we are recording. I will pop a link to be able to give feedback in the chat. So if you're able to complete that, that would be much appreciated. I will now hand over to Andy and Fozia.
Thanks very much, Ashley. As the more eagle-eyed of you might have noticed, there was a third name on the introductory slide, which was Vikas Kumar. Vic was supposed to be co-presenting with us today, but unfortunately he's not well. So he messaged this morning to send his apologies. He is going to be a big miss in today's session, but as there are three presenters, we decided we'd go ahead with only two of us. I've got notes of the part that Vic was going to speak to, which I can do a mediocre job of, and I thought a mediocre job was better than no job at all. So I'm doing the opening section, Fozia is doing the middle bit, and then Vic was going to do the closing bit. For those of you who don't know Vikas Kumar, he's the director of Gem Arts. He's a very important and passionate voice for diversity inclusion in the Northeast, and the bit that he's was due to be talking about is very much about diversity and inclusion. So you'll forgive me when I, as a white man, step in and talk about the diversity and inclusion bit, but at this point, it's needs must and wanting to keep going with what we have planned anyway. So we're talking about the Gateshead Community Bridgebuilders. As Ashley said in the introduction, the Gateshead Community Bridgebuilders are focused on building community power. We are a group comprised of 10 people, but where the majority of those people are representatives of diverse and marginalized communities across Gateshead. I'll talk a little bit about how the Bridgebuilders are structured, about how we started, and then also just the process that we use for decision making. Before I hand over to Fozia, who is one of the Bridgebuilders, who will talk about what it's actually like to be a bridge builder from a disadvantaged community of Gateshead. The Gateshead Community Bridgebuilders started about 4 years ago when the Lankelly Chase Foundation, a philanthropic foundation that some of you might have heard of, was setting up what they call their place inquiry. They were really interested about devolving decision-making power over their philanthropic funds to place. And they identified Gateshead as one of the places that they would like to devolve power to. They connected with folk that they knew in the area, and through those contacts, they got in touch with me. And I ended up pulling a team together from people across Gateshead that became the first iteration of what then was called the Gateshead Coordination Team. we went through what was a fairly administrative process about formally devolving power from the Lankelly board to this team. And then had a conversation at the end of that process about what did we want to do now that we had the authority over the funds. And people really didn't know, which was quite a confusing moment. It was quite a moment of self-reckoning for this fledgling team. One of the things that we recognized at that point was that while we had a lot of people that work at Gateshead institutions, the people and communities that make up the population of Gateshead were not well represented in this group. So we looked at ourselves and we went, okay, what we really need is people from communities of Gateshead making up this team. So we started talking to friends across the borough. We had an idea of the sort of person that we were looking for. I want to highlight a key word in that phrase, which is person. We didn't go, this is a role, these are the skills and qualifications that we need to fill. We were looking for people who were well known and trusted in their community, who held really strong networks and relationships across their community, and who had a reputation for being active in doing things in service of their community. So we went out to our networks of friends and organizations and said, who do you know like this? We had an information event almost 3 years ago. It was, what year is this, 24? November 2021, where we just invited people to come and have a chat to us about this bridge builder idea that we had. And Fozia was one of about 20 people who came along to that event. I'll tell you more about the recruitment process a little bit later, but we ended up bringing on board 7 bridge builders, largely from ethnic minority communities, but two of the bridge builders represent communities of disability. So we're a real blend. We have an annual budget, and the bridge builder role is to draw on their relationships within their community, surface ideas within their community about what would help the community, what would improve the community, what does the community want to do. The bridge builder's role is at the first part to take those ideas and work it into a proposal, which is then brought to the team of bridge builders. And we have a decision-making process where the other bridge builders ask questions about it, seek clarifications, make suggestions about how to improve it. And as long as nobody has any objections to it, we try to do it. So part of our decision-making approach is being inclined to say yes. And if any other bridge builder wants to raise an objection to a proposal, part of what goes with raising an objection is the responsibility to work with the proposal bringer to overcome the objection. After a proposal has been approved, what tends to happen then is the bridge builder is actively involved in the work that the funding is there to make happen. So Paul, who's one of our bridge builders, he's a deaf man. He would be here today, but he is at the launch event for the YI Deaf Festival that hopefully some of you may have heard of. So Paul has been working tirelessly for the last 2 years, building relationships across the different deaf communities in the Northeast, and has pulled those communities together to set up a deaf festival, which is happening on the 1st and 2nd of November, but the launch event is today. And this whole festival has been planned and conceived by young deaf artists. So it's both a celebration of the deaf community, but also a leadership development opportunity for young deaf artists. And Paul has been playing a sort of linking and facilitatory role. So Paul brought a proposal for that. It went through our process, and then Paul has been making the thing happen on the other end, and it's going live today, which is a really exciting point for us and for Paul. With that, I might hand over to Fozia now to talk about how she's found it stepping into this quite weird, quite unusual role as a bridge builder and the accompanying structure. So over to you, Fozia.
Thank you so much, Andy. My connection is a little bit poor, so do let me know if you can hear me. thank you so much for inviting us today to talk about the bridge builders and what we do. What is it like to be a bridge builder? I think it's been a fantastic experience, a great experience, where it was, how can I describe it? It was like a breath of fresh air. And I always describe the feeling of stepping into this role as being liberated. So why do I feel like that way? Because I've worked in traditional roles in public sector, both local government and central government. I've worked in the charity sector, but they've always been very prescriptive. So, you know, the job description, you've got to follow all of that, and you've got rules and regs. And not saying that we don't have a job description with rules and regs, but it was done in a very different way. Andy will talk about the recruitment process. And yes, you know, we were called in about 20 of us just to come and talk. So it was very person-centered. And from the very start, I got a really good feeling that, oh, this is really good. This is like something I've never come across before. So it was, I instantly thought, yeah, I really want to work with this team, because it was just so human. It was, they really cared about me, where in other roles, you know, you apply, they don't really see you. And, you know, you it's a piece of paper which they decide on, where, you know, whether they're going to invite you for interview or not. So it was very different. And here I was given, I've been given the time to grow and explore. And Andy always says, it's okay if it doesn't work the first time. And he has a motto, go slow and let it grow. And that is exactly what we're doing. You know, it's not that we're testing out ideas. We are working on things that are really, you know, that we're really passionate about. So I've been able to follow my passion of working in, you know, working towards women's health inequalities, for marginalized women. Women like me from marginalized backgrounds don't really get to sit at decision-making tables. So one of the things that I really found empowering was that I was listened to. I was, you know, I was given validation. I was given a chance to speak. You know, you've heard this cliche, you know, finding you know, women have a voice, but all women have a voice. And I was able to actually use that voice in actual terms. And so that's been really empowering for me. I'm working in my bridge builder role. I actually work with marginalized women, predominantly South Asian women. I've recently done some stuff around mental health barriers for South Asian women, which I worked with Mind and Search Newcastle, and also Gateshead Muslim Centre. I have done a new proposal where I'm looking at doing some work around diet, nutrition, and exercise. And one of the things that, when we ran the focus groups, and we've done stuff around some stuff with health innovation as well around healthy hearts, one of the things that the women have told me in my meetings with them is that they've never really been listened to like this. They've never been invited to, you know, a decision-making table like I was, to actually talk about what really matters to them. As we know the state of the health service at the moment. You know, people aren't able to get an appointment to see the doctor. They have to wait for weeks and weeks. So when we ran the healthy heart checks, they were given 20 minutes each. They were given a full MOT. It was so different from the traditional, you know, health that interventions that they get at the GP surgery or at the hospital. So that's been that's been really life-changing for them, and for me also, because I get to actually work on things and move with things really quickly, whereas in my other roles I would have to wait and get permission and get it signed off. And not that I don't have, you know, we do have a system here, but it's a flat structure. Everybody's equal and everybody gets to decide. So I've really enjoyed myself so far, and it's been great.
Wonderful.
If you have questions, please do ask.
I'll do Vic's bit, and then we'll pause for questions at the end, because I'm sure people have questions for both of us. Okay. The first point that Vic was going to talk about was the need for inclusive representation in the workforce. One of the things that we like being able to say about the bridge builders is the population of Gateshead is 97% white, but the population of the bridge builder team is 40% white. And the largest religious group in the bridge builder team is Muslim. We've tried to build an alternative decision-making structure here that is very much focused around the experiences of people on the margins, the experiences of people from marginalized communities. We talk about this work as being about extending and diversifying who gets to be involved in decision-making, and also changing the ways in which decisions get made. So the starting point is obviously bringing a diverse set of people into the room. The metaphor we use is, it's not about having a seat at the table, it's about building a new table. And part of building a new table is also looking at the way decisions are made and the way power is exercised. Obviously, Fozia and I are talking about the positives of the Gateshead Community Bridgebuilders, but it has been a really hard road to get us to where we are right now. And Fozia has talked about it being liberating, and that absolutely has been a core part of Fozia's experience. She's been very vocal about that. But Fozia and most of the other bridge builders actually found it really confusing when they first stepped in. We've described the role as we described it to people at the information event 3 years ago, which was an opportunity to come in and bring your experience and your community relationships into a decision-making seat. The opportunity to bring your ideas in and shape up the role as you see it, which is the intention and is what happened. But also part of what happened is people came in and all of those old structures immediately reasserted themselves. So my experience as being the coordinator of this is, when the bridge builder started, a lot of them were looking to me to tell them what to do. And it it took a lot of time and it took a lot of relationship building to move past that. And that, you know, there's a whole story in that which I'm not going to go into, but that was really hard. That was really hard for everybody, because the idea of liberation, the idea of decision making, is quite different to the reality. And there was definitely a period, we talk about it as a period of unlearning. Like, people needed to unlearn the practices that go with conventional decision making tables. And we have built something that is truly wonderful. Just the support, the relationships, the person-centered nature of this is great. But it took some hard yards to get there. But that work is really necessary, because I think one thing that is understood is there is a real risk of harm being done by asking people from marginalized communities to step into existing decision-making spaces and just behave like the existing system does. That's actually not honoring their experience, not honoring their difference, which is why we've tried to build a new table, as I've described. I feel like I'm glossing over so much detail right now, and if people want to ask more questions about any part of this, like, feel free when we get to the end of this bit. But all of this approach about trying to build a new table, trying to change the way decisions got made and power is exercised, it started in the recruitment process. As we were looking for people, for concrete individuals with concrete networks of relationships in their community, we knew that we had to recruit differently. So we had the information event, as you've heard from both me and Fozia. And the next thing that we did to open up recruitment was we asked people to answer 3 questions. There was a question about their community, there was a question about the role, and there was a question about the skills that they bring. And when we asked people to answer those questions, there were 2 things that we did that turned out to be really powerful, like more powerful than we'd imagined they would be. The first thing that we did is we said to people, you can answer those questions in whatever form or whatever language you want. So it doesn't have to be in writing. If you want to record yourself, if you want to send a voice note, that's absolutely fine. And if English isn't your first language and you want to answer those questions in your first language, that is fine too. But we just ask you to flag with us in advance so that we can arrange translation in a timely fashion. Now, as it happened, all of the 9-10 people who applied for a bridge builder role applied in writing and wrote in English. But what we've been told is offering that made all the difference, because that showed that we were serious about diversity and inclusion. We were serious about respecting and honoring the cultural differences. That made it safe for people to apply. The second thing that we did that people have told us has been really powerful, and I tell this story a lot, is we didn't ask people for a CV. One of our colleagues, Zara, talks about this quite a lot. Zara is an amazing person and an amazing bridge builder. She's done some fantastic work working with newly arrived refugees and asylum seekers, and really focusing on the lack of support for people who enter the country as a refugee or an asylum seeker, and the lack of support there is for the language barriers that they face there. Zara has said to us, if you'd asked me for a CV, I wouldn't have applied. And that was really stark for me, and I didn't understand it. But Zara explained she has a rich wealth of experience of working and volunteering within her community, but she hasn't held a lot of paid roles in her time. So because she hasn't held those paid roles, she feels that her experience is less worthy, less valuable than people who've held paid roles. And she views a CV as a document of your paid experience. So if we'd asked for a CV, Zara would have felt that she couldn't apply because she doesn't have that paid professional experience, and we would have missed out on one of our best bridge builders. Now, that is something we didn't know when we didn't ask for a CV. We were just trying to keep things simple at the beginning of the recruitment process, but we lucked out there. But that was absolutely an invisible barrier that we've learned. Just moving on from the recruitment process, and I know I haven't described all of the recruitment process, but that's certainly one of the key bits. The final point that Vic was going to cover is the impact of devolved decision making and empowering a diverse bridge builder workforce on the communities they serve. So as I said, we've got 6 or ostensibly 6.5 bridge builders in our team of 10, representing different communities. You've heard a little bit about what Fozia is working on. I've told a brief story about the work that Zara's doing. I've talked about Paul and the Deaf Festival he's been building within the deaf communities for the past year. We have Hakan from the Gateshead Turkish community. The Turkish community has been running a Saturday school for the last couple of years, which is providing extra educational support for children of migrants to help them cope better with the UK education system, and also deal with what it's like to grow up being of two cultures. We have Eric, who is a Cameroonian man who does a lot of work with a variety of groups across the African diaspora of the Northeast. One of the pieces of work that HACAN's running at the moment is a sports and well-being project, which is looking to bring together the different African communities under the heading, under sports and well-being activities, and use that as a way to build community connections between these different communities. We have Afroz, who's been doing some work with Fozia, working largely with small community groups of women of colour, but also trying to connect those groups with other groups of white British women. And one of the mechanisms that Afroz has used for that is sewing. So developing sewing groups and connecting sewing groups and building bridges between those different communities in that way. And then we have Christine, who lives and works in the community of Teams in Dunstan in Gateshead. And Christine has done a lot of work about further devolving decision making. So it's done a lot of sort of participatory grant making stuff in Teams in Dunstan, where community groups have received relatively small pots of money, but £2,000 is not unusual. And then the group has been taken through a process exploring what they would like to do with the £2,000 to improve their community locally. So we have this growing network of communities with bridge builders at the core, connecting them, working on very practical things to make things better for parts of their community, but then also building this ever-expanding network of connections and relationships and support, building bridges between communities. And we're really excited. We're running a large event. We ran our first large public event in November last year, and we're doing a follow-up event on 12th of November this year. And what we're doing is we're going to be inviting all of our communities to come together, to meet, to connect, to explore. And that is the end of the presentation bit. So absolutely questions, if there's things you'd like to ask myself and Fozia, there's space for that. But then we'd also like to take some of the space in the remaining half hour of the session to really bring all of you into the conversation. And so to ask you the question about how are you going to take anything that you've heard me and Fozia talk about today and apply this to your work scenario? So why don't we start with questions from you for me and Fozia, and then we'll flip the script and we'll ask you. Ashley, are you okay to curate questions?
Yeah, no problem at all. Halim has popped his hand.
Oh yeah, sorry, it's not just a question, it's more a statement, just to say well done and congratulations, really. And I think I'm sat here thinking I'm amazed, like, and really proud, really, to see that you've taken the steps to recruit, people from diverse communities. But I think in particular you've gone that one step further to kind of build those bridges with those communities. So I think, given the current kind of climate and stuff, I think I just wanted to say well done and applaud you, really, and say thank you for doing that. I think it's fantastic.
Thank you. That's a lovely thing to hear.
Lovely. Anybody else got any questions? Feel free to pop them in the chat as well. I can always field them that way as well. I have popped a link to the event that Andy mentioned in the chat as well for you all. So have a look at that as you're able to book on through that link as well. Oh, Halim.
Oh yeah, sorry, just one quick question. I did wonder, and I'm happy to have this conversation separate, but in terms of how this is funded and resourced, you've obviously got a philanthropic arm to the organisation. Do you get any resources from anywhere else, like local authorities, through through any other kind of public agencies? How's the whole scheme kind of funded?
Yeah, thanks for asking that question. So I don't know if people have heard of the Lankelly Chase Foundation or not, but Lankelly Chase have been one of the most progressive UK philanthropic funders for the last 10 years. And as part of their journey, they decided and announced decided last year, announced this year. Do I have the timings right? No, announced last year that they're going to cease to exist. They're going to redistribute all of their assets and cease to exist as a philanthropic foundation. I'm not going to go into their reasons for doing that, but in a nutshell, they think that philanthropy is part of the problem. This was quite a concerning announcement for us, because this work began very simply as a partnership with the Lankelly Chase Foundation. So pretty much all of the funding that we've received to date has come from Lankelly, so there hasn't been local authority funding. We're at the point of the relationship with Lankelly coming to an end. So one of the things that we are actively looking at is what are other sources of funding, what are the connections that we can make so we can keep doing what we've been doing and keep building on it. We probably have, this is still to be confirmed, we probably have about 18 months of funding left from Lankelly. So we're not at the end of the road yet. But you've absolutely touched on quite a critical concern for us at this moment in time.
No, thank you for that. It was really helpful.
Then got a question from Daniel.
Hi there. I think Halim and I are on the same page, because I was going to ask a very similar question, but just also, so just make sure I'm clear and just in understanding some of the language you talked about these roles. So Fozia and others, is this your like full-time occupation in terms of a role, or is this something you are doing on top of, you know, whatever else you've got going on in your life?
So I work with the Bridge Builders full time, but I do have another very, very part-time role with the medical school at University of Sunderland, where I'm working on the IMCAN study, which is encouraging Muslim women to uptake bowel, breast and cervical screening. And that covers the North East and Scotland. So I'm working in the Northeast for that, but it's very, very part-time. I only work 6 hours a week, but that's usually over the weekends and evenings, and you know, just engaging women. And we've engaged over 250 women in the last 12 months. So it's a feasibility study, but if you want to find out more, you know, I can certainly send you some more information about that. But this is my full-time role. Prior to this, I was working with Newcastle City Council Public Health and also the Good Things Foundation on a digital inclusion project.
Thanks.
Just picking up on that question just very briefly, Daniel. One of the things that we decided quite early in the piece was that we knew that we needed to pay people for their time. Paying people to participate has relatively recently become fairly standard practice, but we actually wanted to go one step further, which is create substantive roles for people to step into. The reason that we chose to do that is about capacity. One of the things that we'd seen before we made the decision to create the bridge builder role is that the people who understood best what we were trying to do, you know, under this broad heading of building community power, were the people who were able to turn up regularly. I mean, it sounds obvious, and yet I think we often overlook this. So we wanted to make sure that we were giving people sufficient capacity to engage in the work substantively and in depth, because that was going to be essential to you know, getting good outcomes and outputs from the work. So we created paid positions, and when we went through the recruitment process, we let the bridge builders decide like how big a job they wanted, up to and including full-time. What's been wonderfully reassuring for us is when we hired the bridge builders, it was sort of like 50% of the roles that we offered to people, they had asked for a part-time role, and then the other 50% asked for a full-time role. And then over the last 2.5 years, the part-time people have said, actually, I'd like to do this full-time. So, you know, if nothing else, that at least is an indicator that we're doing something well here.
And just to add to that, I think the flexibility really worked for all of us, because, you know, we don't have to present or clock in or clock out. You know, that's been so different to my previous work, but it also allows us, that the real, it's a true action, what we're doing here in terms of work-life balance. And there's been occasions where if you're not well or whatever, the care and the support that we get. And I know that I'm saying a lot of nice things, because they are nice things, and they do exist, because I personally have worked in so many different roles, but I've never really had that person-centered care before, and that's been really, really nice. I just want to go back to when I talked about being a bridge builder and how difficult it was, which Andy's touched on. And I think I took a very systems approach, and on a weekly basis I was like, we've got a WhatsApp group for the team, and I'd say, well, this week I've been doing this and this and this, and I saw that other people weren't really doing that, apart from one of our colleagues, Christine, used to do that. And then all of a sudden we saw, oh, right, we're not supposed to be doing this. But it was quite hard for me to move away from that systems way of working, the KPIs, the targets, the performance, how many people have got to engage, and all of that. So that's you've got a target of 1,000 people to work, to target for your digital inclusion and all of that. So it's been a very different way of working, but one where I've been able to really really use my voice in a real way. I've gone out and done things which I wouldn't have got a chance to do if I was in my other roles, like the Women's Health Conference, for instance, which we've had 2, and I was part of both of them. So, having involvement in that, I don't think I would have ever got onto the panel in the last conference if I was working in any other job. So it's been a real privilege to be a bridge builder, and I just hope that we can continue to grow. Yeah, that's it.
Fozia. Kia, you got a question?
Yeah, sorry. If there's any shaking or thudding, it's because they're knocking down the building next to mine.
Oh gosh.
So I apologise for that. Yeah, I just was like, I'd be really interested to hear about any other examples of getting people involved in healthcare, and particularly in terms of co-production. So I work for the health literacy team for the North East, and that's something we're really interested in doing more of in the future.
Can I take this one, Andy? Yeah. I think, yeah, it's brilliant here. I used to work in the health literacy team in public health, Newcastle. So, there's a great need, especially with marginalised communities. We're open to that, absolutely. And this is what we're actually doing. We're educating, marginalised communities in terms of health, and doing it their way as opposed to, our way. So, yeah, absolutely. Yeah, I'll give you an example. We've just worked with, I mentioned earlier, we worked with Mind, who funded us to do 2 focus groups, one in Newcastle, which we did with Search Newcastle, and I was hosted at Age UK Gateshead, and we did one in Gateshead in partnership with Gateshead Muslim Centre. So there's a report available on how we did that. But what we're doing, when we got involved with Mind, we said we want to see tangible outcomes, because we've got a research culture at the minute. It's research overload with communities. There's a lot of extraction, but not really a lot of action. So this is where we differ, where we want, if we're going to get involved with somebody, we want to see okay, what are you going to do for the communities that we're serving? We're all serving the same communities, and we have to work together. We can't do it in silos. So, the Bridge Builder team is very, very open to working with these services, but in sort of in a very different way. So mine are now the recommendations that we had in the report. They're actually actioning that. One of the recommendations was that they need to train their staff, frontline staff, and other staff in cultural competency, because if you don't have cultural competency, how are you supposed to serve the communities? How are you supposed to understand them? And we always hear services saying, we never, hard to reach communities, seldom heard communities. That has to change. And that's where you start. One of the basic things is, getting people educated about the different cultures. And that's been really, really welcoming to see them actually, take on our recommendations on board and working with us. They are now going to put in place some counselling for our women, and also some confidence building skill, for the women, because that's what they've asked for. So it's just not about, mental health and how to obviously improve that, which we are going to do. But also look at them as individuals. So okay, what do you want to do? What is it that we can, how we can improve your lives? So they've been great. So that's one of the examples that we can give you, how we're working with healthcare in Gateshead in partnership with others.
And just to add on a second example quickly, so our colleague Zara, who I mentioned, who has been working with newly arrived refugees and asylum seekers, that work actually developed out of a partnership with primary care in Gateshead, where there were a couple of GP surgeries that were responsible for providing the primary care to the refugees and asylum seekers. But they were really struggling with that. There were problems with helping the newly arrived people get vaccinations. There are also problems with the newly arrived people not showing up to follow-up appointments at the GP practice. So Zara just started spending time in the hotel where the people were being housed and just building relationships. And one of the things that people said to her is, the fact you look like me, makes a difference. It just means I'm more likely to talk to you than I am a white doctor. It also helps that Zara spoke the same language as some of the refugees and asylum seekers. But through the relationship she was able to build, she was able to surface a few things there. One of the things that she surfaced was that people didn't understand what the follow-up appointment was for. So there was a communication issue there, which was a language issue as much as anything. Another reason why people weren't attending follow-up appointments is they didn't understand how to get to the practice. They didn't know how to catch a bus in the UK. And so these very practical barriers were some of the things that were stopping people from attending the follow-up appointments and getting the healthcare they needed. So when Zahra started actually running some language classes for people in their first 6 months in country, she designed them to have a very, very practical focus. So it wasn't specifically about vocabulary. It was about, here's how to read a bus timetable, and here are the phrases that you need to speak to the driver in order to catch a bus. But also the way that Zara ran those classes was just beautiful. It was so personal, so relational. She says that people in those classes call her sister, they call her auntie. That's the sort of connection she's been able to build through the way that she's done this. And as I said, all of that grew out of a partnership with primary care.
Thanks, Andy. Now I've got Hannah.
Hi, I'm really sorry I arrived very late, so I apologise if I missed some of this, but What I was interested in is, with all the kind of insights and the really important things that you're learning through this work, how is that channeled effectively at a sort of strategic level? Because I work in County Durham. There's lots and lots of different kinds of activity trying to involve people, a bit like what you were referring to, Fozia, around like a service goes and wants to know from perhaps a particular target group, but how that's collated on a bigger scale and fed in an effective way to the decision making is a bit more confusing to me. And I just wondered if you had anything to share on that.
A very, very simple sentence, which is the learning is not collated strategically or channeled well, which is not particularly helpful. But I think this is very much the nature of building from the grassroots. There's a lot of stuff that we've done well that we're very proud of. There's an awful lot that we have learned through this. But codifying that and finding ways to share that and building relationships across the wider system through that sharing, that's basically where we are now in our journey. So I'll sort of point and go, this session, right, this is one of the things that we're doing to try to make that happen. We've got a couple of written documents that are just being polished up, and they'll be circulated as well, so there's that as well. But yeah, there's been a massive amount of learning, and we're just sort of starting to shift the focus onto how on earth do we share this learning. So an open call to everybody who's here. If you have ways to help us share the learning, please get in touch. We need some help with that.
Yeah, ditto. Thank you.
Halim.
It's just a comment, really. I think one of the things I've picked up is, I mean, I don't believe in this whole hard to reach thing. I think you've just got to learn to do things differently, and I think we've all got to learn to apply ourselves differently in what we do, and in particular, getting out to certain parts of the communities. So yeah, that is something I will take away. Just a quick point for Fozia as well. I'd really appreciate if you could share the screening update work you've done around some particular communities and stuff. So, you said you've done some work, so if you could share that with us, that would be great. And just say thank you very much. Sorry, I'm going to have to leave as well, so just want to say thanks for that. Been really helpful.
Thanks, Halim.
Thanks, Halim. Brilliant.
Thank you.
Any further questions from anyone? Jade.
Yeah, hi. I think it's probably just for you, Fozia. So it's just more of a question just to learn a bit more about exactly how the bridge builders engage with their communities. So is it a case of just attending things like community groups that already exist? Just kind of how you guys make sure that you're representing your community's ideas? Is it just a case of kind of informal conversations with people? Do people ever use things like questionnaires? Or is it just a case of building on the kind of relationships and networks that you've got in the community?
So it's a combination of all of them, Jade. But I've actually gone out and stood outside supermarkets and shopping centres to recruit women, especially when I did the healthy heart checks. And so there's pockets of using the intelligence that we have, from the census and, public health teams of, and also our asylum seeker refugee teams in the council to see where, there's pockets of people. So targeting those areas, reaching out through community centres in those areas, schools, the community centres, existing groups, existing networks that we have. And also we do a lot of work through WhatsApp groups. Obviously, there's a lot of women engaged through WhatsApp groups, various groups, they're selling and buying things. There's food groups, there's all sorts. And I think there's roughly around 600 women that I engage with usually on these groups. So I did actually build a new group, and that was one of the things that as a bridge builder that we were, encouraged to do. So I've concentrated on in Felling. So my new proposal, which I've put forward, is for a diet, nutrition and health programme with for South Asian women, and that's going to be run through Felling Community Centre. So I've targeted schools, primary schools, obviously a lot of, you know, mothers, also carers, and worked with as I said, I got a lot of response when I've stood outside shops on Coatswood Road and stuff, or in Felling, outside the supermarket and stuff. And we got 62 women to attend the healthy heart checks. So that was predominantly from, you know, the Felling, Bentham area, which was great. But you know, you have to go out and reach out to the communities. You can't sit and wait for them to come to you, and that's where I think, you know, you've got to do the legwork. And the other thing is, you know, as we mentioned, if you are going to work with diverse communities, you've got to have people that look like them. As Andy said, you know, when he related Zara's story, that, you know, she gets called Auntie. Zara is an absolute beautiful person inside and out, and you know, you have to have that, build that relationship. So you have to have people that look like those communities. And I'm very vocal about this, because when I worked in public health, I was one, maybe 2 out of 40 odd people in the team, and that was one of the things I raised. And now I think they've got a very diverse team. Not saying that they listen to me, but it's really welcoming to see that. But I've been in places where, you know, I'm the only brown face. Even now, when you go to meetings or conferences or whatever, you know, you come across and there's very, very few people, and that has to change. You know, we live in a very diverse society, so there's a lot of inequalities. And we live in a very unequal world, and that has to change.
I just want to indicate the presence of Eric, who's another one of our bridge builders. Eric, I'm not going to ask you to speak because that would be unfair. But Eric, if you can hear me, can you just give a wave? That was a wave. Just chiming in about Eric, like from what Fozia said, like, the approach that we take to connecting with the communities is definitely relationships before data. And I just wanted to indicate, Eric, not only to say we've got another bridge builder on the call, which is great, but also, like, Eric is an amazing individual. Eric goes, he's on the go all the time, going, like, showing up where people are, building connections face to face. I worry about Eric, because I worry that he's going to burn himself out by how much he just goes around and meets people. But it's all about building trust through building relationships. And one of the lovely things about the role that Eric plays in the African communities across the Northeast is people trust him. So a lot of times where people have a problem, I've got this thing I need help with, I don't know where to go, they go to Eric. Eric doesn't know where to go, but Eric helps the people find where to go as well. Now, this cuts both ways, because that does put a lot of responsibility on Eric, which can also be quite hard to hold, I think. And this thing comes back to the stuff that Fozia's flagged already about the support. It is essential that the bridge builder team is a really mutually supportive environment, because the bridge builder role is hard. It is about building a lot of relationships, and you never know what's going to come out of those relationships. Yeah, but that's certainly how Eric and how a lot of the other bridge builders also connect with the communities and make sure that we're surfacing what's representative of the communities.
Brilliant. Thanks, Andy and Fozia. Just one last question, and probably one for each of you, really. What would be the one thing you would recommend people to take away from this session if they wanted to start this journey of co-production, building community power? What's the one piece of advice you would give?
I'm hoping you're going first, Fozia.
I would say, don't be afraid to work, to, you know, go out of your comfort zone. And, you know, we're serving the same communities. So come and talk to us. You can come and talk to any, you know, come and if you want to come and visit any of our groups, we're very, very open to that. We would welcome you. Also, in terms of working with diverse communities, you know, go and explore and, you know, find out, and don't be afraid, because half of the time what I've seen, and this is from observation and from my experience, is that people don't really know how to actually approach communities, is because, you know, they haven't done that before. Not saying that you know you don't, but you know we haven't got that. We haven't got a customer service facing role or whatever. But it's really good to actually get to know other communities and to work with them.
Over to you, Andy.
Yeah, thanks for giving me some time, Fozia. Just wanted to boil it down. I think my pithy sentence would be dream big, start small.
I like that. Brilliant.
By which you can see how the Bridge Builder experiment, we're really challenging ourselves to do a lot of things differently. It's taken us 3 years to get to this point. Mm-hmm. Yeah, it's one thing to say we need more people of color on this existing group. It's a very different thing to imagine a whole new group. So that's the dream big part, but the start small part is you can't go from 0 to 100 instantly. So dream big, start small, and start with relationships. And I don't think I need to explain that last bit.
Yeah, brilliant. Thank you both so much. Really do appreciate you guys coming along and sharing the fantastic work that you're all doing. So thank you. I know Andy mentioned there about the like a case study basically that we've got as well. So we will be sharing that as well as the recording of today's session as well on Boost. So if you've got any colleagues that you think would really benefit from hearing about this, please share it more widely with them, because as I said, we will have the recording and a further case study as well. And then my final ask from you all, if you're able to give us some feedback, that would be much appreciated. I've just popped the link to that in the chat box. So thank you again, Fozia and Andy, really do appreciate that. And thank you everybody for your questions and participation. Lovely. And enjoy the rest of your afternoon, everybody. Take care. Bye-bye.
Thanks, everybody.
Thank
you. Thanks, everyone.